Good day. My name is Clara Francesca A. Roa, Development Management Officer 3 of the Health Facility Development Bureau. Today, I will give an overview of the Department of Health Procedures Manual for Government Hospitals, 3rd edition. The presentation includes the introduction, the overview of the Procedures Manual, and the brief description of the chapters. To start, let me give you a brief description of the Health Facility Development Bureau. The Health Facility Development Bureau, or the HFDB, is a bureau under the Department of Health, Health Facilities and Infrastructure Development Team led by Undersecretary Lilibet C. David. The HFDB, headed by Director Maria Teresa G. Vera, as an administrative unit in 3 functional divisions, namely the Policy, Planning, and Program Development Division, the Health Systems Development and Management Support Division, and the Facility Performance Management Division. The HFDB is mandated to perform the following. First, to develop plans, policies, programs, and strategies on health facility development, planning, operation, and management. Second, to provide coordination, technical assistance, capacity building, consulting, and advisory services related to health facility development, planning, operation, and management. And third, to advise the Secretary and the Undersecretary of Health on matters pertaining to health facility development, planning, operation, and management. We now go to the main topic of this presentation, the overview of the DOH Procedures Manual for Government Hospitals, 3rd edition. The Procedures Manual is only one of the manual of standards in the set developed by HFDB. As a guide to the implementation and management of these health services, especially in government hospitals, HFDB is currently updating these manual of standards for each services and departments under the Integrated Hospital Operations and Management Program. This Procedures Manual is best used in conjunction with the following manuals. Manual of Organization and Management of the Administrative and Finance Service for Hospitals, Hospital Property and Supply Management Manual, Hospital Nursing Service Administration Manual, Hospital Pharmacy Management Manual, Hospital Nutrition and Dietetic Service Management Manual, Manual for Medical Social Workers, 5th edition, Manual of Standards for Infection Control in Healthcare Facilities, Quality Management Systems in Clinical Laboratories, Manual of Standards and Guidelines on the Management of Hospital Emergency Department, Revised Organizational Structure and Staffing Standards for Government Hospitals, CY 2013 edition, Hospital Health Information Management Manual, Healthcare Waste Management Manual, Manual on Packaging and Transport of Laboratory Specimens for Referral, Manual of Standards on Laboratory Biosafety and Biosecurity, Manual on Technical Guidelines for Hospital Planning and Design, 250-bed hospital level 3, and 100-bed hospital level 2. Manual of Standards for Management of Hospital Finance Service, and Procedures Manual for Government Hospitals. The Procedures Manual consists of general procedures under the different services and departments in the hospital. These procedures have been written in such a way as to accommodate and provide discretion to the hospitals in terms of the specific details and strategies in its implementation, while still being consistent with the standards. The manual is applicable to all government hospitals. For the 3rd edition, the following limitations have been identified. First, it provides only the minimum required steps in a procedure, which gives the hospital prerogative to introduce modifications such as additional steps or procedures, variation in forms used, and others. This is provided that DOH standards are still complied with, especially in the computerization or automation of hospital systems, and the major steps are still present to ensure the same desired outcome and output are achieved. Second, The procedures aim to provide systems administrator or computer programmers an overview of simplified standards to assist them in the transition or upgrading of the system. The procedures shall be understood and interpreted in consonance with the other hfdb manual of standards as well as policies, plans of the hospitals. Shown here is the cover of the procedures manual for government hospitals 3rd edition. The procedures included in this manual of operations operates on the principles of continuum quality improvement and took into consideration standards under the Integrated Hospital Operations and Management Program. Further, it supports the mandate of Republic Act number 11223 or the Universal Healthcare Act. As mentioned, the hfdb Manual of Standards are part of the following DOH programs. First is the Integrated Hospital Operations and Management Program, or commonly known as IHO. It is a flagship program of the hfdb that ensures the implementation of standards and guidelines aimed to improve efficiency and effectiveness of healthcare services through creation and use of information for clinical, administrative, and monitoring purposes in hospitals and other health facilities. Second is the Continuous Quality Improvement or CQI, which is the performance management arm of the National Quality Framework in Health. It ensures that all consumers receive the highest quality and most cost-effective health services through the development and maintenance of a qualified, diverse, and accessible multidisciplinary network, care, and service organization. This manual is divided into 4 parts. Part 1, Introduction, is the discussion of the background and rationale, objectives, and scope and coverage of this manual. Part 2, Description and flowcharts of the procedures. This part includes a description and corresponding flowchart of the procedures of the different services and departments in a hospital. Part 3, References, and Part 4, Appendices. Let me discuss to you the short description of each chapter. For Part 1, or the introduction, it consists of the following: background and rationale, objectives, and scope and coverage of this manual. Part 2, description and flowcharts of the procedure. This part includes the description and corresponding flowchart of the various procedures and the different services and departments of the hospital. For this procedures manual, there are a total of 109 prioritized procedures for 20 services, departments, or areas within the hospital. Lastly, the manual includes references and appendices portion. Again, flashed on your screen is the 3rd edition of the Procedures Manual for Government Hospitals. The manual has been circularized last August 2021 through DOH Department Circular number 2021-0389. You may access a copy of the manual together with the other hfdb Manual of Standards through the link provided here. Before I end this presentation, let me share with you other programs launched under hfdb. These are the systems, programs, projects, and databases being handled by hfdb. You may contact us for more information on the programs mentioned in this presentation at the following details. For Procedures Manual specific queries, please email us at hfdb@doh.gov.ph. Maraming salamat po.